Good day, my name's Martin Hales and I'm a podiatrist. I'm here today to talk about the effect of splints and orthotics in managing patients with rheumatoid arthritis. A question that we need to ask is, do semi-rigid insoles or orthotics help patients with rheumatoid arthritis? In particular, are they effective in treating rheumatoid arthritis, particularly for pain relief and for decreased disease activity? The answer to these questions is yes. Yes, semi-rigid insoles are effective in treating rheumatoid arthritis. They help decrease the pain associated with this disease, and they help decrease the disease activity associated with this disease. Let's look at a case where semi-rigid insoles and extra depth shoes have been shown to be effective. Jill's a 56-year-old dental hygienist at a busy dental doctor's clinic. She enjoys walking to work, but was recently diagnosed with rheumatoid arthritis about 2 years ago and has been experiencing some pain within her feet. She's on her feet most of the day and wants a solution. She read about the people getting a grip on arthritis at a website. At the website, Jill found that there were different types of semi-rigid insoles and extra depth shoes that would help her foot pain. She obtained these, and although she still has some discomfort from time to time, she feels that she can get back to relatively normal activity without the continuous pain that she'd been suffering before. What were the components of the information that Jill found out? Well, she certainly found out that this particular care is useful in patients of around about 60 years of age that have rheumatoid arthritis within their feet and have had the disease for at least 1 year. Let's look more specifically at the components of Jill's treatment. The first component is the extra depth shoe. This consists of a shoe with instep lacing that maintains the position of the foot within the shoe. It consists of a wide and deep toe box that will help the foot fit within the shoe when swollen and moderately deformed. It consists of a high, deep heel counter that controls the motion of the foot within the shoe, a heel height of about 1.5 to 2 centimeters that helps facilitate normal walking, and importantly, a thick composite insole that helps cushion the foot and facilitates rockering of the shoe and therefore decreases the amount of work that the arthritic foot needs to perform. These shoes are available in all kinds of styles, designs and colors for both men and women, and certainly as time has progressed, manufacturers are producing shoes that are cosmetically much more appealing to patients. The other component of Jill's treatment consists of the use of a semi-rigid insole or orthotic. In her case, they consisted of a 3mm subortholine shell taken to a non-weight bearing cast. There are many types of foot orthoses, both custom and over-the-counter available, and these will perform different functions. Let's look at the important components of a semi-rigid insole. In particular, they were made to a plaster cast of the patient's foot. The material is then heat molded over the cast of the foot to give strong support under the ball and under the heel of the foot. And they will also have some kind of top covering and cushioning that will help protect the foot from the weight-bearing forces. Patients with rheumatoid arthritis frequently suffer with inflamed metatarsal phalangeal joints, which are these small joints under the front part of the foot. This will often lead to splaying of the foot, which in turn will then lead to overloading of these small metatarsal phalangeal joints in this particular area. So the insoles will help maintain the foot position and improve shock attenuation, and therefore improve the pain and decrease some of the disease activity. Other things that help patients with rheumatoid arthritis within the foot utilize extra depth shoes and semi-rigid insoles is the use of aids such as long-handled shoe horns, perhaps the use of elastic laces that help facilitate access into the shoe, or even the use of an extra depth shoe that may have some form of Velcro fastening. Therefore, it makes them much easier to put on. Other important things to consider is how long are you wearing the insoles and the shoes. The study showed that a minimum of 6.5 hours use per day was important to get the level of relief that Jill obtained. There is no point in investing both your time and money in obtaining these devices if they are kept in the wardrobe and then you continue to walk barefoot, say for instance, around your house. So therefore you need to wear these things as much as possible. And although this study concluded after approximately 3 months, the researchers theorized that it is likely that the benefit will continue beyond this period of time. Good day, my name's Martin Hales and I'm a podiatrist. I'm here today to talk about the use of splints and orthotics in managing osteoarthritis. In particular, does a strapped lateral insole help? Are strapped lateral insoles effective in treating osteoarthritis? Do they help pain relief? And do they help improve physical function? The answer is yes. Strapped lateral insoles are effective in treating osteoarthritis. They do give you pain relief, and they are helpful in giving improved physical function. Who do they work for? Well, let's look at a case. Daniel is a 56-year-old retired bodybuilder. About 5 years ago, he started developing some chronic pain within his knees. At that time, he was diagnosed with osteoarthritis. On a recent vacation to Japan, he saw an advertisement of a new kind of insole called a strapped lateral insole. At first, he was a little bit concerned about obtaining these, but after he did buy them, he found a reduced amount of pain in his knees and was eventually glad that he bought them. Who do they work for? Well, we certainly know that they work for patients between about the age of 55 to 70 years of age. In particular, was osteoarthritis of the knees with a disease duration of about 5 to 8 years. In particular, what we're looking at is osteoarthritis in the medial aspect or this component of the knee. What is a wedged lateral insole? It consists really of two distinct components. It consists of a strap that is placed around and under the ankle. And what does this strap do? This strap limits the amount of motion within the foot. It stops the foot from pronating and supinating, or at least diminishes that amount of motion. What is the second component? The second component is a wedge placed on the outside of the foot, very much like a shim. How do we think this works? Well, many patients who have osteoarthritis within their knee have somewhat a bow leg deformity, where the leg sits at that particular position. This in turn causes wear on the inside of the knee, causing osteoarthritis. By placing a simple shim and controlling foot motion, what we do is actually open up the knee position, decreasing the amount of force applied to the knee here, and therefore diminishing the patient's pain and improving their physical function. What we can see here is a foot in a flat position or a fully pronated position, and as we said, what will happen is that the strap will prevent that from occurring, because if we didn't have the strap, it would force the position of the foot even further into that position, but still wouldn't have a significant effect on improving the knee pain. All right, what are other important components that we know about using the strapped lateral insole? Well, we know that they need to be worn for approximately 3 to 6 hours per day for a minimum of 6 months. And although the researchers finished their study at 6 months' time, they theorized that the effect of the strapped lateral insole will continue beyond that point.